Our speaker, we are very fortunate to have Dr. Gary Cusick with us. He is known in the blind community for his work on Charles Bonnet Syndrome, which he'll tell us about. It's where you might not have good vision, but you can see things that really aren't there. And it's called Charles Bonnet Syndrome, and he will tell us about that and allay any of your fears that you might be, losing it. So he earned his doctorate in rehabilitation psychology in 1990 from the University of Wisconsin in Madison, and he will tell us about the history and the treatment of Charles Bonnet Syndrome. It's common in people with sight loss. Prior to working with OVR Blind Division for 18 years, Dr. Cusick taught live and online university classes, did research in mental health, and worked in nursing
Recording
homes,
in progress.
hospitals, and private settings. Currently, he provides information and counseling on Charles Bonnet Syndrome, sometimes abbreviated as CBS, and convenes a weekly support group meeting via Zoom for people affected by this condition. He works collaboratively with a nonprofit and a podcaster in the United States, and he is in regular contact with providers in the UK, in Australia, and in Canada. He's a retired clinical psychologist, used to work at the Charles McDowell Center in Louisville, and he's come from Louisville today to be with us and give us his time and expertise in this area. So we welcome Dr. Cusick.
There's no sound coming out of the speakers. We can just barely hear what you're saying.
Hey y'all. Hello. I'm Gary Cusick. I'm
Howdy!
I was born in Louisville, Kentucky. Went to the University of Louisville, and then later at the University of Kentucky. Finished up at the University of Wisconsin-Madison. Sure. Get close to it. There we go. Okay. So, Charles Bonnet Syndrome. How did I get involved in it? Well, I worked at the McDowell Center, as she said, for 18 years as a clinical psychologist. And every now and then I'd hear somebody say something about Charles Bonnet Syndrome, but never very much, And this is a place that you would think people would know about it. And then one day this young woman came to me and she said, I'm seeing these distorted faces and cobwebs. It's really bothering me. And I really did not know what to do with it. Did not know what to do for her. There wasn't any information out there to speak of, any of that. So that got me started on maybe a 6-year journey that led me to you, dealing with Charles Bonnet. Most people, when they first are looking up Charles Bonnet, they'll find Esme's Umbrella, which is a not-for-profit in London, England, run by Judith Potts. That's how I found out about it. She was delighted to find me because she's got a lot of referrals from the United States and wanted to kind of pass those on to me. Let's see. Let's do some history. Charles Bonnet was a naturalist in 1780 who wrote a paper about his grandfather who had cataracts and Charles Bonnet Syndrome. Now, he seemed to be pretty clear cognitively, but he was seeing things that weren't there. Okay, so if you're seeing things that aren't there and you have a visual impairment, I'm delighted to tell you, you are not crazy. Okay, now, one of the people I was talking to at lunch was telling me she went in to see her neurologist who had never heard of it before, who told her she'd made it up. And I hear that a lot, and I hear that a lot from people all over the United States. My support group is, we got people from California, Texas, North Carolina, New York, and I think where else. Pretty good spread,
Here's your seat. Spin you around here.
So, as she was saying, I have a couple of collaborators in addition to not being very used to using a microphone. And one is Eva Potts. She has a nonprofit in honor of her mother who had Charles Bonnet. That's in North Carolina. There's a fellow named Shimon Foy who does a really good podcast on Charles Bonnet. He lives in Queens. You can get his podcast anytime by just putting in Charles Bonnet Syndrome podcast. Very, very good. There's a lot of it there too. Okay, so why don't doctors know anything about that? The reason is most people who are visually impaired are elderly. And if you're an elderly person and you go in and talk to the doctor and say, "Doctor, I'm seeing things," what are they going to think? They think, "Well, you must be psychotic or demented." All right, that's just lazy diagnosis is all that is. It's dementia is a pretty easy to establish with some really short tests, so it's not that big of a deal. But why don't doctors know about it? And the reason is people aren't talking about it. You go in, see your eye doctor, they do whatever they're going to do, and you never mention it. So doctors think it's very rare. They'll just hear about it from one or two people over a 20-year career. They might just hear about it from just a few people. Okay, now all of us know it is not uncommon. My experience with the McDowell Center was that, because I saw everybody, was about 1 in 3 had it. And I don't know if the other 2/3 were lying to me or not, because that happens too. So where's it come from? Well, okay, now I'll give you my elevator speech on Charles Bonnet. Here it is. Okay, so you get to the elevator, you hit 2. Okay, I got 1 floor to tell you about it. Okay, you get a limb cut off, you're likely to have phantom limb pain, where it feels like you still have your toes. Okay, you lose some hearing like me, and you have your ears ring. That's a hallucination also. And if you can't see, what's that hallucination? What's that hallucination like? It's visual. It's all visual. It can start out very simple with colors and shapes, patterns, and that sort of thing, and evolve into more complex things. People, vehicles, trees, animals, and mixtures of things. Mixtures of people and animals, and just about anything you can imagine. A couple of triggers seem to be grocery stores and when you're riding in a car. One lady in Texas was telling me she was riding in a car and they were getting passed by an Amish horse and buggy on the highway. So, yeah, probably not.
Hey, how fast was the buggy going?
Well, the buggy was not going anywhere. The buggy didn't exist. So where's all this come from? Okay, your whole life, if you've had vision, even for just a few years, you've developed visual memories. About 2/3 of your brain is all about vision. Maybe not necessarily sight, but it's about figuring out what it is you're looking at. It'll compare it to other things you've seen that are like that. Okay, so all that is stored away, and that glaucoma finally catches up with you, and now you can't see too well. Well, maybe you can still see a little bit, light perception, or maybe just some blurs. Okay, it's not known how far your eyesight has to go before you develop Charles Bonnet. Maybe 60%, in one eye. So you can have Charles Bonnet if you're blind in just one eye. I know several people that have it with just one eye. It can be very distressing to some folks, because they'll see people sitting around the house that they don't know. If any of you all have Charles Bonnet, there might be a lot of people in the room here, more than there really is. Sound familiar? Yeah, people will say, "I don't know who those people are, but I wish they'd get off my couch and get out of here." That's pretty common. I would expect that in any nursing home you went to where a person had a visual impairment, you'd find somebody with Charles Bonnet Syndrome, and everyone working with them just figured they had dementia. Okay. So you go to your doctor and you say you're seeing things. The ophthalmologist doesn't know what to do for you. They really don't have any treatment for that, like they don't have any treatment for your eye condition, probably. And so they'll tell you, well, I'll send you off to the psychiatrist. Okay, psychiatrist makes sense if you're hearing things. It's an auditory hallucination. You go to a psychiatrist. But if you're seeing things, you should probably go to a neurologist or an ophthalmologist. So they get into those folks, and those people with all their years of training and everything don't know about Charles Bonnet either. So as I was saying, years ago when that one young woman came to see me, I thought, nobody knows anything about this, and I had just by accident become a blind psychologist. And I worked, my background was all in rehab, working with folks with intellectual disabilities, and mental illness, and various things. Got the job at the McDowell Center, and got to be pretty good at working with blind folks. You know, blind folks are different. They have different brains. Okay, you probably have a better verbal memory than you should have, and I have data to prove that. You know, but where do the visions, phantoms? A lot of people don't like the word hallucinations. Where do those come from? They come from your visual memory, just as dreams do. Dreams come through your visual memory. The difference is when you're dreaming, you're delusional because you think it's real. Okay? With Charles Bonnet, you have a pretty good idea it's not real. People will sit kind of on the fence, you know. They'll say, oh, I know it's not real, but then they'll start talking about they. You hear that word they. Well, yeah, but they're digging in my backyard. You know, and they moved into the other bedroom, you know, just all kinds of things. So it takes a while to get used to that idea. You know, you're used to, you know, seeing is believing, right? You're used to that. So it takes a bit of an adjustment. So why don't doctors have anything to read about Charles Bonnet? I don't know what the answer to that one is. There's about 300 articles in the medical literature about Charles Bonnet Syndrome. I know that from over the years I've had a Google search thing that sends me every new article about Charles Bonnet. Okay, and you'll find that the majority of them are case studies. They'll say this 88-year-old woman came in who had retinitis pigmentosa, and she was seeing these things and all that. And then what do they do next? They try to give you a drug for it. All right. There is no drug known right now that works for Charles Bonnet. Will it work for you? I don't know. Ask your doctor. I'm not a doctor. I'm a doctor of philosophy. I'm not a doctor of medicine. Okay, so definitely, I'm not going to ever tell you to do something your doctor told you to do. Give it a try. Sometimes it works. Typical things are they'll give you anti-seizure drugs like gabapentin, which kind of makes sense because that's deals with nerve pain. Like if you have tingling in your hands or feet from diabetes, that's a good choice. So this is sort of like that. So let's give them this gabapentin. They'll also give you an antipsychotic, and antipsychotics work on psychosis. The new ones work great for people who have psychosis. How great? Well, when I was working in Columbus, Ohio, with the Department of Mental Health, we had found that of the 10 hospitals in the whole state, the number of people with schizophrenia was going down. So people being served was going down. Did that mean we weren't giving good service, or what was the deal? And I analyzed the data and found, yes, indeed, over the years it had been going down. And I think the reason for that was the new antipsychotics. They're very good. They work, and they have a lighter side effect profile than other ones do. A lot of the old stuff, Haldol, Thorazine, you wind up doing pill rolling or having some sort of tardive dyskinesia, extrapyramidal symptoms.
I have that.
Yep, me too.
Ooh.
Not a great choice. If you're anxious, maybe an anti-anxiety medication would be good for a while. Be better to deal with the anxiety itself rather than just keep taking benzodiazepine, which is very addictive, and you shouldn't take more than 30 days. Any psychiatrist will tell you that. But they work really good when you're in an acute state. Let's see. So there's the theory of why Charles Bonnet happens. It's called deafferentiation, and I had to practice saying that all the way up here. You've stopped seeing things, and your brain is like your brain gets excited and starts to produce things that you see. And like I said earlier, it starts out with colors or shapes, patterns. It can go into patterns would be things like wallpaper, checkerboards. One fellow in Minnesota sees an American flag all the time. It's an American flag laid out over everything. He can see a little bit, so he can sort of see through it. The trick to knowing what's Charles Bonnet and what's not is that the Charles Bonnet is clearer than your vision is. Right? You have a visual impairment and you see something and it's real clear, crystal clear, more clearer than anything you've seen in years. It's Charles Bonnet. It's not a real thing. So that's a real easy one. Also, they don't talk, right? It's just visual. You shouldn't hear anything. Okay? If you hear something, somebody's trying to get in the front door and you hear them shaking the doorknob, it's not Charles Bonnet. It's somebody you need to call the police about.
Okay.
So I think we're going to get a bunch of questions. So I'm going to wrap up here in a bit. So treatment. Okay. So you can say it's not real. Just ignore it. That's what everybody says. And it's good advice if you can, but if you can't, it's useless. It's useless. I think it's better to try to think of it as something that's not you. This is not you doing. I mean, it comes from you, but it is not you. You aren't Charles Bonnet. It's like you aren't depression, you aren't anxiety, you aren't psychosis. That's a thing that happens, but it doesn't define who you are. So I've been working with some people to try to figure out what would be the way to do that. Meditation is pretty good. It gives you an opportunity to start thinking about thought, which is kind of a crazy idea for some people, meta thought. If you can think about thought, you can realize that what you're seeing isn't real. But that takes some practice, so meditation helps a lot. Cognitive behavioral therapy would be very helpful as well to help you with any beliefs that you have about these things being real. Okay, so what are you going to see? All right, let's start with people. So you'll see people you'll see people who are dead, you'll see people you've never seen before. That's very common. Sometimes the people will have distorted features, big teeth, big eyes, big ears. It's anything. It's if you've ever had vision, then your brain can just sort of improvise on what it has to work with, and the product that you see is Charles Bonnet.
Do you have paperwork on that?
Do you have what?
Paperwork.
Paperwork on Charles Bonnet? Sure, I'll get it to Susan. She can spread it around. Sure. Oh yeah, there's a lot of things actually. The group in London, England, Esme's Umbrella. Esme was this woman's mother, so she named the nonprofit after her mother, Esme. And they've been going at it for a long time. They got universities involved. They got a lot of money for research. They got some big name neurologists involved that know about it. And I think generally speaking, the UK has a much better grasp of Charles Bonnet than the US does.
The people that have Alzheimer's or schizophrenia, is it dealing with that you talking about?
Okay, it's not schizophrenia, it's not dementia, it's not Alzheimer's. It's its own thing. Okay, you know, I don't know, you go to school and you learn all these words. One of them is hallucination. People, when you're talking to them about Charles Bonnet, they don't like that word. I get that. But I have a hallucination. It's called tinnitus. My ears ring because I don't hear very well. It's a hallucination. You put your ear right up to mine, you don't hear anything. Where's it coming from? It's coming from my brain. So when you see things, it's coming from your brain. I am not doing well on this thing. On this microphone thing. Okay, there we go. Yes, ma'am.
And when you're going through the process of diagnosis,
Uh-huh.
I guess, what is the protocol? Is it like process of elimination? I know I'm going to see a neurologist,
Okay.
I guess for brain scans, MRIs, what have you.
Right.
I mean, how do they determine? I think I know what it is.
That's
but
an excellent question.
How do you go through that? And
Oh.
what should I not, look to not do or do?
Okay. Well, I don't know if you've heard of Oliver Sacks. He wrote like popular neurology books, if you can imagine such a thing. Great writer. Has a great TED talk on Charles Bonnet. You should listen to
Oliver
as well.
Sacks.
Oliver Sacks, S-A-C-K-S. He has a book called Hallucinations, and the first chapter is called Charles Bonnet Syndrome, the Silent Multitude. So what he's saying there is lots and lots of people have Charles Bonnet, but they ain't talking. And that's true. That's true.
I understand why.
Oh yeah. Well, you don't want to go to the doctor and tell them you're seeing things, especially if you're elderly.
No, but I did it.
Okay, so it's a great idea if you're starting to see things like Charles Bonnet. It's a great idea to eliminate anything else it could be: tumors, Lewy body dementia, Parkinson's. Some medications cause hallucinations. If any of you are taking omeprazole, so it's an antacid. Okay, omeprazole will make you more likely to have a hallucination.
Really?
So I would suggest you go to something like Pepsi or what? Talk to
I
your
don't
doctor.
take it.
Okay, you have to talk to your doctor. A lot of old people take an acid. I do. Okay. You got a question? Yes, sir.
Is it also being stressed and tired?
Absolutely. If you're,
Because that seems like when it hits me, when I'm
Yes.
really stressed, which I am a lot, but and tired, then that's when it comes on, and it lasts for a while and then diminishes.
okay, great. It's
That's the
if you're
trigger.
tired, in pain, you're lonely, you're depressed, you're anxious. Any of those things can make Charles Bonnet worse. During the COVID lockdown, some researchers in London found that Charles Bonnet got a little bit worse during the Charles Bonnet thing because there's just like this background of anxiety that everybody had. Okay, so the scans. Okay, if you scan a person with Charles Bonnet, you got them in there and they're seeing the dog sitting right next to them or whatever it is they see, and they look at their brain scan. It looks perfectly normal. It looks like nothing's going wrong. Okay, it looks like you're seeing something. Okay, so because your brain is seeing something, and the glucose areas that you see sometimes in science shows, but different parts light up. It'll light up.
Brain reaction at all?
I'm sorry.
I'm sorry. There's no brain reaction at all.
Well, it's in your brain, but it
Yeah,
doesn't.
The scan doesn't show it.
No, does not show it. And there's been lots of research on that. They'll say, here's a person with Parkinson's, and they're having hallucinations, and they can see the Parkinson's, they can see the Lewy body dementia, they can see the head injury if you had a head injury, because some people are blind from head injuries. But your brain with Charles Bonnet looks perfectly normal. There's nothing wrong with your brain. It just wants to see something. Maybe it's trying to prime the pump. It's like, haven't seen nothing for a while. How about this? Let's start out with that. You had a question, sir?
Yeah, okay, now I've talked to several visually impaired people that I know, and we all seem to have the same deal, and I don't know if it's Bonnet syndrome or not, it could be. Like at night, I'll turn the light out, and totally black room, so it's pitch black in there, but it looks to me like the light's still on.
Yeah.
Yes.
Is that Bonnet syndrome?
Yes, can be. Can
Okay.
be.
I find that I'm under more stress and by myself. The stress is, I found that just my stress is the trigger point, and that starts my movies, and I do meditation and yoga,
Excellent.
and that seems to calm the
Excellent.
brain down. But you know, when I first told my daughter, my doctor, that I was having these hallucinations, and you know, like I was telling you, they told me I was crazy, and he sent me
Yeah.
to it for MRI.
Yep.
And I told him, I said, you're not gonna see anything out of it. It's not, you're not gonna have, my MRI is not gonna
not gonna
show
show anything.
any kind of neurology symptoms, you know,
Right.
anything that's wrong with my brain. I said, it's not gonna show anything. It has to do with my brain compensating for the loss of my vision, but it's still showing me things that I can see, that I used to see back in the day,
Right.
or how I
Or
found that-
variations on it,
I
yeah.
found that stress is really a trigger, like the young lady back there that was just saying. Stress, yoga helps. Yoga really helps. Meditation really helps. Go into a quiet room. Go sit on the toilet in the bathroom, and just be still and be quiet,
Okay.
and just watch your movies, and they'll diminish after a while.
Yeah. Sometimes people see cartoons. Anybody see cartoons? See a couple of nods. You go into the bathroom at night and you go take a shower, and there's a bunch of people in the shower already. They're all naked men in the shower, or they could be naked women. Okay, so it's pretty creepy, and it could kind of make you not want to take a shower that night. One of the folks, I have a support group that I do every Saturday, and one of the folks from Texas, when she goes to the bathroom at night, there's somebody sitting in the bathroom chair when she gets in there, every time. And after the Olympics, she started seeing Snoop Dogg. I don't know if y'all saw any Snoop Dogg during the Olympics. He was fabulous. Yeah, so Snoop sounds pretty good. This same lady has some hallucinations that are always the same. What she has is her cherubs, little baby angels, flying around her head all the time. Anytime she looks up, she can see these little angels flying around her head. But she'll also see, and that's okay for her. She kind of almost feels like it's a protective thing. But she also sees, I'm making little quote marks in the air, the dark man. Okay, so there's some kind of presence that's dark, and she doesn't like that person. Yeah, ma'am. I'm sorry. You got your hand up. Go ahead. Yes, ma'am.
I have two questions. One is, I did have this, I don't have it, I miss it.
Okay.
Are there people who have intermittent and people who have continual? Are there two different sets of data for those?
There isn't a whole lot of data for any of it, to be honest with you, because if you think about it, most of the medical personnel don't know anything about it.
Well, with doctors,
They're
they
MDs.
book learning if it's not in the book,
Right.
generally
Right.
speaking,
That's just being lazy. I worked at the McDowell Center for 18 years. I can't believe how many ways there are to be blind, and I looked every single one of them up.
so there's no doubt on that.
Okay, so, but let me continue with that answer. So there must be some threshold at which Charles Bonnet starts. Is it a certain level of vision? I don't know what it is. So some people will have cataract surgery that goes bad. They wake up and they got Charles Bonnet, they got people standing over them right away. All right, some people that takes a while. They have to go through the simple hallucinations before they get into the complex ones. I'll get you there, sir, Mr. BDC. I'll get you in just a minute. And one lady I worked with had lost her vision, and she didn't have any Charles Bonnet for 6 years. What's the deal? It's not an on and off thing. Is it a neurotransmitter thing? That sounds pretty likely. That's not been proven by any means yet. But it can come and go. I've known people that have had it and it goes away and it never comes back. Some people it kind of comes and goes. That's fine, that happens too. I think the best thing you can do for yourself when you have Charles Bonnet is to keep yourself busy, have a life. Don't let the people in the Charles Bonnet people take over your life and shove you into the corner. Really. Some people, they just get so freaked out by it, they stop doing anything. And then their families families don't know what to do with them, because your family doesn't know how to deal with you when you're just blind, right? Yeah, I'm going to move this furniture around to make it easier for you.
My second question was, besides, the stuff, is if it's correlated like to amygdala or some other aspect of the brain that reflects on your personality. Because I didn't see people I would like to. I'd probably be talking to them. There were no people that appeared anywhere.
Okay.
It was very lovely and it was very nice. It was flowers and a whole floral thing. One time it looked like a brick wall, and I knew that it wasn't real. I sat there and looked at it, and I thought, it'd be nice if that wall looked like that. So I enjoyed it. I had a good time.
Some people, some people like it.
Did anything, but I'm wondering, does it reflect on your personality? Somebody with a darker, maybe childhood issue or something is going to have, like you're saying, somebody in a black coat or whatever it is. Right.
That's a very good, really very good observation. If you are anxious or depressed and you have like a clinical case, that a psychologist would say, you got this thing, Charles Bonnet will be worse for you. So you need to get that treated, if only because of the Charles Bonnet. If you won't get it treated for anything else, that's a good reason to get it treated. Now your amygdala that's a great observation. So primitive man are walking around on the African savanna, and here comes a saber-toothed tiger, okay? Their brain tells them, run, you fool. Their amygdala tells them to run before they even know they've seen the saber-toothed tiger. It's microseconds faster, but you don't know why. But it's also, you're taking that first step, and you don't even know why yet, but you're going to know very quickly. Personality.
Well, because the size of the amygdala reflects the amount of fear that people have. So some have big amygdalas and some have little ones.
What you think about a lot is where your brain develops. You develop a lot of connections if you think about certain things. London cab drivers gave them brain scans after they had some kind of requirement. They had to memorize all the streets in London, without a map. And those guys had part of their hypothalamus was bigger than it would be normally. So that's that. Personality-wise, if you can calm down, like Janice was saying a minute ago, if you can get yourself calmed down, it's going to help a lot. The main thing is not to take it too seriously. One of the folks in my support group took off running one time because of her Charles Bonnet, fell and broke her shoulder. Okay, so Charles Bonnet probably make you more likely to have a fall, because sometimes your house doesn't look like your house. It's somebody else's house, or you're out in the woods, or you're anywhere, right? So you're thinking everything you see is really there. So you're walking around stuff, but then you forgot about that ottoman that's been there for 20 years, and you trip over it. So using your cane inside is really helpful if you can do that. Some people have done various things like put those tube lights around doors if they can have a little bit of vision, so they can at least find the bathroom. You always got to find the bathroom. You got to find the bathroom when you need the bathroom. So let's see. Ma'am, I see your hand there. This fellow's had his hand up for a minute. Yeah, there you go. Thank you.
I see apartments all the time, stationary. And sometimes I focus in on it, thinking somebody may come out the door. But never see nobody.
Okay.
And I see Santa Claus hanging off the building.
Okay.
And then one time I was hallucination vision went into me driving down the highway, and the road turned. And when the road turned, I slammed into a tree.
Okay.
And I know the road didn't turn, so I've been going straight.
Yeah. So you're seeing apartments from the outside?
I'm sorry.
You were seeing apartments from the outside? Like apartment buildings?
We're seeing the apartment from the outside.
No, it's been my vision.
Oh, okay, okay.
I just kept waiting and watching, see if anybody would come out. Never no one came out, and of course that was my, it was like a hallucination.
Right.
But I have this all the time.
Right.
And I have stars that constantly stay on top of the upper part of my eyes, my glasses.
Mm-hmm.
Stars that never move, never come down.
Okay. It's a little more likely to happen in the evening when when things are getting dark at dusk. It's a little more likely to happen. Not true for everybody. Some people see it only with their eyes open. Some people see it all the time, eyes open or eyes closed. There's a lot of individual variation. I think I started calling it 360-degree Charles Bonnet or immersive Charles Bonnet, where you're in a setting that's not real, but you can turn all the way around and it looks like you're in a new setting. You're at your grandma's house from 40 years ago. You're in a place that you don't recognize. You're out in the woods. Anything. It can be very scary for people. They wake up and they're somewhere else. Like, how did I get? This one lady would tell me, I wake up and I'm in a hay wagon out in the field, and she didn't know how she got there. Well, how do you do that? Well, one way to go is to test reality. Reach back for the wall or the headboard, and even though you can't see it, you'll feel it. You know it's there, so you can keep yourself settled down a little bit. Pets are very helpful. If you're out someplace and you think, where am I? I don't know where I'm at. Here, boy. Dog comes up. You're home. You're okay. I'm worried about people that have Charles Bonnet, begin to think it's real, and it starts to mess with them psychologically. That's always been my fear. There's not a whole lot to read about Charles Bonnet, so I've read all around it. Okay, let's read about hallucinations. Let's read about delusions, because people, they don't just see things, they have a story about it. Okay? When you see things and you have a story about it, the psychiatrist says, that's schizophrenia, because you met the first two criteria for schizophrenia. Now your story is, a lot of times people come up with a pretty plausible story. I've talked to schizophrenics before, and they have a pretty plausible story. This is different. People kind of think it's real, kind of don't think it's real. But the best thing you can do for yourself is keep busy, stay in touch with people, have a real life, have a life of the mind, and you're less likely to have it. Ma'am, you have had your arm up a couple times.
Yeah, I just wanted to say, about 20 years ago, I was getting tested for a kidney transplant.
Mm-hmm.
And they give you all kinds of tests, and every one almost that you can think of. And so they sent me to a psychiatrist, and he asked me, do you see lights in your head? And I didn't answer, because I didn't know what to say. It was true, though. I saw them, but I didn't want to tell him.
Yeah.
Just like you said, because I didn't know why he asked the question, for one, and I didn't want it to disqualify me.
Yeah.
But it doesn't always, I don't. So the only way, usually I notice it in the evening, I guess, like you said, when it happens. But I just asked my husband, I would say, is the light on? Because I couldn't tell. And he would say, no.
Yeah.
And here it would be looking really bright, just like you said it.
Yeah.
It is clear.
I hear people say that all the time. They may have no light perception and they'll insist on having every light in the house on.
Yeah. And I could when I closed my eyes, I didn't see it. That was good.
Oh, okay.
But
One
it's
lady.
interesting that he was I guess the main reason I asked the question though, is why did he ask me that? And that was about 20 years ago, you know, why did
Okay.
he ask?
Okay. It's been around forever. Okay, how long has Charles Bonnet been around? It's not a new thing. It's been around as long as people have had eyes and brains. Okay? So I'm not trying to convert anybody, but let's look at the book of Mark in the New Testament. Okay, Jesus comes out and there's a blind beggar there, and he puts some slime on his eyelids, and he says, "What do you see now?" And the beggar says, "I see men walking like trees." That sure sounds like Charles Bonnet to me. Okay, and then he does it again. Now the blind man can see, so that, you know. So
Maybe I'm on my way then.
on your way to the miracle?
Being able to see, yeah.
Oh, I don't know. I hope so. Yes, ma'am.
Dr. Cusick, you said you had done 18 years at McDowell Center.
McDowell, yeah.
Do you have an opinion or an explanation as to why England is aware and studying and researching and America is not, and
Yes.
our medical personnel are so literally in the dark about this very syndrome?
Nicely said. Yeah, I do. One is Judith Potts, who runs Esme's Umbrella. She is a force of nature. Her husband worked for the Associated Press. She was an actress. She wrote a column for the Daily Telegraph. So she was already kind of in with a lot of people. So she could get attention from people. That's one thing. The
What's
other
her name? Excuse me.
Judith Potts. Now, you'll find that an Eva Potts in North Carolina, who is not related to her, but is also doing a nonprofit in honor of her mother. The UK, the other UK, has had general health or complete social health coverage for the whole country since the 50s. Since the 50s. Of course, you talk to people in the United States, go, "Oh, we can't do that here. Oh, that's socialism. Oh, that's this and that." Every country, every industrialized country on the planet has socialized medicine, with the exception of the United States. So I think that's a big part of it as well. So you have to get paid. You know, the doctors have to get paid. They run in the door, they see you for 15 minutes, they run back out the door. How long will they wait for you? How long will they listen to you before they start doing something? Research says 13 seconds. 13 seconds. Best thing you can do is go into a doctor with a written list of stuff you want to get answered. That's the way to go with that. How am I doing? We doing all right?
Yeah, we're doing good on time.
Okay. Okay.
Yeah, 10 more minutes.
Wouldn't that depend on the doctor?
Please?
I said, wouldn't that depend on the doctor?
No, it
As
depends
well.
on the insurance company.
Well,
that too.
yeah. I do a support group for Charles Bonnet because there's no one else doing it. No one else doing it. You know, it really sucks to be an expert sometimes. You know, it's like, what do you mean I know more than anybody else does?
I have another question.
Sure.
I'm very involved with Sanders Brown, and I do a lot of ongoing education with Sanders Brown.
Mm-hmm.
Are they aware at all of that component and part of their analysis, particularly if they are assessing someone with low vision or visual problems?
I don't know.
Is that a question I need to ask?
Yes, and I'll be happy to talk. I'll be happy to talk to him if you'd like. I'm retired now, so I got lots of time. I spend a lot of time on Charles Bonnet. This is kind of my mission, I guess, now, because there isn't anybody else. There's not much of anything else. I got a call from some attorneys in Colorado one time. They wanted a Charles Bonnet expert, and I said, "Oh, okay, yeah, I know about that. Where'd you hear about me from?" And they said, "Australia." Because there's a guy named Scott Meriden in Australia who runs a Charles Bonnet Foundation there. So it's Charles Meriden in Australia. Lucia Ricardo, you gotta love that name, right? Lucia Ricardo is in Toronto. Judith Potts in the UK. Me and Eva are here in the United States. And there's a lady in the Caribbean that does some things with Charles Bonnet. We've never been able to get a hold of her, so it'd be really nice to just get everybody talking. We have all the same problems and all that. But your yeah, go ahead.
Did you say, I know you said you were retired,
Mhm.
but are you willing to talk to doctors
Sure,
for them to get more knowledge?
absolutely.
From you?
Are they willing to listen to you? Is better for your heart problem.
I think I found one that will.
Okay, great. I have a couple.
Actually, should be zooming in today.
Okay, excellent.
So I can get your information before I leave. You have a card or something?
Sure. You can call me. You can send me emails, however you want to do that.
I'll get your information after then.
Okay. There's a couple of notable ophthalmologists or neuro-ophthalmologists that are aware of it.
Are they in this area?
No.
Yeah.
No, they're not. There's
I've
one.
actually been going to Cincinnati Eye Institute because the people at UK, they can't keep them because they won't give them money to do anything.
Yeah, and they have a big debt when they graduate.
Yeah.
Yeah, that's true.
And so I've been going there, but I have RP,
Mhm.
and I've been going once a year, but it's just kind of in vain, you know. Well, there's nothing we can do, there's nothing anymore. And then anytime a clinical trial comes near anything, it's like, well, because of your age. So I went to a new ophthalmologist in my hometown who's very interested in it.
Okay.
She's younger and wants to know everything.
I'll talk to her.
Yeah.
She can
Okay.
call me, or I'll call her, or however
Okay.
you want to do that.
Thank you.
I've had a couple of ophthalmologists call me and ask. One called me from New Jersey one time while the patient was still in the room.
Wow.
And we talked a little bit about it, and I talked to her a little bit, and that's you got to be HIPAA happy too, because
Right.
medical information is confidential. But the more I talked to her, I thought, no, she's got something else going on other than just Charles Bonnet. Somebody asked a question about diagnosis.
I did.
Yeah, how I didn't answer that. The International Classification of Diseases 11, which is used all over the world, a little bit in the United States, slowly being adopted, has Charles Bonnet as an actual diagnosis. They'll say it's in people who have had a vision loss, who are cognitively intact. They're not demented or anything like that, and it's not a mental illness. That's in the diagnosis. I think I can talk to you on the phone and tell you if you got Charles Bonnet or not, just because of it's very typical how it develops. Person's got a visual impairment, and when I'm talking to people, I'm listening closely to their vocabulary and stuff, just kind of gauge and get an idea of what's going on in their head. And there's so many bright people with Charles Bonnet. Now, can you have dementia, schizophrenia, other things with Charles Bonnet? Sure you can. Sure you can. There's no protection from that. Blind brains are just different. I said that earlier. No one has ever known of a case of schizophrenia in a person who was born blind. It's never been seen. Never been seen. Why is that? Well, schizophrenia must have something to do with vision. I don't know what it is, but it must have something to do with vision. I don't know. I've been amazed for years at what blind people can do. Lady walked into my office one time, went, "Oh, you moved your office around." She was right. I had. She didn't have any vision at all. She had 2 prosthetic eyes. What's she doing? She's listening to the space, I guess. I can't do that. But the really tough part of it is going to talk to a doctor who doesn't know about it and refuses to learn anything about it. My agency didn't know anything about it. I did a presentation for them. They didn't know anything about it. One of the staff members had a visual impairment, and she talked about it a little bit, which maybe they believed me a little bit more after that. And I also presented to some blind educators, K through 12, and not many of them heard about it either. Nobody talks about it. You can have it when you're a child. You don't have to be older. You just have to have a visual impairment and have had some vision for some time. One gal had Charles Bonnet, and she's telling her parents she's seeing all these things, and what do? They take her to a psychiatrist. They load her up with antipsychotics until she turned 18 and said, "No, I'm not taking these anymore," because it didn't do anything. All it did was make her kind of sleepy and probably more likely to develop that tardive dyskinesia. Would you say, ma'am? You had your hand up just a minute ago there. You're next door neighbor there.
Did you say people with NLP, no light perception,
Yeah.
that there's never been one who's been schizophrenic?
Born blind. If you're born blind, you cannot have schizophrenia. Believe me, first time I ever read that, I read it again and again. Then I found some other articles that said the same thing.
Like ROP, retinopathy of prematurity, born blind or at perinatal, whatever, around birth, are not schizophrenic.
They evidently they don't develop schizophrenia at all. It doesn't happen.
Makes you wonder then.
Makes you wonder how much you experience.
In reverse, if you have somebody who's schizophrenic, if they did, if you blinded them, I don't know, or they wore something, that would stop the schizophrenia, depending on what the etiology is determined to be.
Yeah, there's been some gene therapy with levers that's been pretty successful. Geez, I hope something happens before I start losing my vision, because if you get old enough, you're going to be blind. Yes, ma'am.
I read a book, and I wish I could remember the name of it. It was really good. And it was about this person that became schizophrenic, and for some reason, they did a dialysis treatment on her, and it cured it.
Oh, okay.
Now, doesn't it sound amazing? I mean, it almost doesn't sound true.
Yeah. Well, you can seem to have mental illnesses with physical illnesses.
But they didn't say that that person had a need for dialysis. They just did it on that person.
That's an adventure. I don't know. People that have diabetes can have some cognitive issues that are specific to them. One of the things I learned about diabetes was I could be walking behind somebody at the McDowell Center, and if they smelled sweet, they needed to check their blood sugar. They got just kind of a sweet smell. It's not offensive or anything, just kind of a sweet smell.
Ketoacidosis.
Thank you. Exactly. So I can get you a letter that says this person has Charles Bonnet Syndrome and explain it all. I've got 300 articles on my laptop about Charles Bonnet, most of which, like I said, are case studies. I don't know. There's not a lot to read about Charles Bonnet at this level. Okay, this level is where the rubber meets the road. It's like, here's a person sitting in the seat and they want some help, and you can't do anything with their eyes. So now what? Right? That's the kind of help I want to provide. I want you to be more comfortable in your own skin. Yes, sir.
Is any of this online?
Pretty much all of it is.
Okay.
Well, how would you like to? I would suggest the Charles Bonnet Syndrome podcast. There's about 30 episodes. There's some neuro-ophthalmologists on there. I'm on there. Guy at the Mayo Clinic in Minnesota that's on there.
Well, I know you mentioned case studies that are on your laptop, and I just wondered if they were on Google.
Yes. I have a Google search, Google Scholar. I have a Google Scholar thing, and the search term is just Charles Bonnet Syndrome.
Okay.
And every time something comes up with Charles Bonnet Syndrome, I'll get an email, with that article. So,
and you recommended Oliver Sacks with the
Oliver
TED Talk.
Oliver Sacks is wonderful. The TED Talk is really good. He's a very good speaker, and the Hallucinations book is very good also. Yes, sir.
Does the syndrome go away?
It can, like the lady 2 doors down from you there said. It can go away. I wish I knew how that happens, why it doesn't progress to more severe forms.
I don't know that I had it,
Okay.
but when I first started losing my eyesight, when riding in the car, the side of the road was plaid.
Yeah, okay.
Everything was plaid color.
Yeah.
Red and green, up and down the road.
Right.
It happened for a few months. I don't remember how long.
Okay.
But it hasn't happened now for several years, 15 or 20 years.
Okay, well, obviously
It
you
just
didn't
happened
worry
for
about
a
it.
short period of time.
Yeah, you didn't worry about it too much.
I didn't worry about it. I
You
didn't
worry
He
about it.
always asks me though, is every,
Okay.
is it covered with red and green plant? No,
Yeah.
sweetheart, it's a dream.
Well, I mean, you can logically say, no, there's not a
Could that
board.
have been Conan Rod's,
It's already-
Okay,
Could have been distorting.
yeah, you need to talk to an ophthalmologist about that.
That's kind of what we figured out.
Yeah,
Probably
but-
was
but
part of the deterioration.
That sure has the ring of Charles Bonnet to me. If you have schizophrenia, you're not seeing things like that. There's certain things people with Charles Bonnet
Well,
see.
you also said earlier that it seems to be clearer than anything you've seen before.
Right.
And that was very clear to me.
Yeah, because you're not seeing it with your eyes, you're seeing it with your brain.
Yeah, I wish that you could sort of will it to happen.
Oh, okay, well.
Lonely afternoon.
Yeah.
I don't know. I've always been working in the other direction. You know, if you get concerned about it, it can make it worse because you start worrying about it and worrying if you're crazy and your family doesn't know. Like I said, don't know what to do with you just because you're blind. They don't know what to do with you. I tell families that they should address the person's emotions. If they're upset about something, address the emotions. Don't argue with them about what they see, and please don't say, "Oh, I see it too." Yes, ma'am.
I was just gonna say, maybe it's like if you lost another limb and, you know, you get that phantom pain for a while, but eventually that goes away, right?
No.
Oh, it doesn't?
No. No.
Oh, no.
I'm pretty
I
much.
thought it did.
That's a hallucination. Phantom limb pain is a hallucination. My tinnitus is a hallucination, and it's probably not going away. Hearing aids help, but your ears ringing doesn't have that taint of craziness that the hallucination does. So people just don't want to talk about it. They'll talk about their ears ringing all day long, but not about the horse they see in the dining room. Yes, ma'am.
Does your brain ever, over time, get used to the lack of images, and this could diminish?
Uh-huh.
I read something like that, and is there any truth to that? I mean,
Yeah.
I've had a sudden deficit in my vision. It's like overnight. And I had some of these things that I had seen previously, but not a lot.
Right.
I had a weekend where I was really tired and stressed. I'd been on planes and stuff, and that night I saw a lot of things that I'd never seen before. And you're correct. They're clear as a bell.
Yeah.
Just as clear as like I used to see years ago, which was very odd. But then I read a little more about it, and I read that somewhere. Can that happen? Your brain can actually get used to the lack of the images, so it doesn't pull them.
You know, when I talk to people about Charles Bonnet, I don't talk to enough people like this lady over here who says she had it a little bit and it went away. I don't talk to people like that because they don't have the problem very much. Usually the people that do well with Charles Bonnet are people that have really good blindness skills. You know, they're just living life. You know, they don't have it's not slowing them down any. They get on the bus and do all that stuff. A friend of a friend had cataracts real bad, and he hadn't had them operated on, and he was a Vietnam veteran. He'd see Vietnamese, and he would say, he'd point at them and say, "You're not real," and they go away. Okay. Sometimes you poke them with your cane, they go away. Sometimes you throw a pillow at them, they go away. Sometimes they'll come back, but if you make an effort to make them go away, it's a victory for you, and you realize that you have power over this. And there is, I don't know how to say this. It's a quality of mind, I guess, that in a person that can just accept it and get to the point where it's not alarming them anymore, and as a result, it fades away. Now, this guy with the cataracts, that's a pretty long day all day long. You're not here. You're not real. You're not real. Pretty long day. But he has cataracts removed and it went away. The only person I've ever known that had it go away. If they can cure your eyesight, it'll go away. Susan's looking at a watch. I'll talk to you on the phone. I talk to people from all over the country. I have a support group every Saturday at noon Eastern Time that you're welcome to. I was wondering if I got enough people, we could just have a separate support group, a Lexington support group. That'd be cool. Here, be on Zoom. Yeah, the one I do is on Zoom. And the support group has 2 hours. The first hour is for folks with Charles Bonnet. Families are on with them. And the second hour, we throw everybody with Charles Bonnet off and just talk to caregivers because they need help too. You know, if you got a husband who says she's crazy, she needs to go to the nursing home, and the kids are saying, "Oh no, she's fine." You know, they're trying to protect their mother. Get into all that stuff. So Susan will have all my contact information. Love to talk to you again. I really appreciate you having me here today.
Thank you.
Oh, thank you. It's got a little point.
Yeah, you can use it on your.
You're not crazy.
I knew it, nothing showed up on your mind, and I said, see, I told you. No, it won't show up. My sisters just wanna put me in there. I know how. Yeah, I know, right? That amount, even going to the hospital makes me crazy.
And over the years, if I heard about anything I've seen, I just didn't
Figured it must be something to do to my mind. I figured it out. I used to call it moving. And she's very interesting. Very different. So I get like,
Oh, yes, sir. Yes, sir. Yeah. I don't know, it's a rock place to use. Well, I'm going to go back.
All right, it's a pleasure talking to you. Oh, no, God did very few perfect kids, and the rest of them covered
You know what I'm here for?
Today?
And then it'll fill out. God bless you.
It's hard. How it is. Yeah, I've been getting Oh, thank you.
Encourage you to wear a costume. That's fine. Yeah, yeah. And we'll have some conversation about how to improve our services too. It'd be good. Yeah. Okay, I'll put your name down. 10 until 12. Next Wednesday here. Okay.
You're all free. Just being careful and they're very organized. Because hopefully, I got it early in the morning down there.
Thank you very much. Very interesting. We'll try to join you in a Zoom sometime. I'll look you up.
Just kind of getting started on it, and they get their kids on it.
India only lost their leader between January She left work in January because she was broken through the walls. And by March 1st, she was completely blind. And there's a dementia diagnosis as well.
Because of
Okay.
Donald Trump, he talks about this all the time. He talks about this in his testimony. Right, man, woman, TV. Remember that? Fall out number TV. There's some things that you it's called the 5-minute thing. So, if you passed it, it's great. He's not very but if somebody who doesn't have the diagnosed.
We're definitely
I'll ask her some questions. Whatever she had really parts, back there with the president's there like that. And I'm there
It's a window.
also
ask her what the date is. Remember some words, there's a book called 1,000 Colored Cassette. It's the artist's mother had Charles. The way he depicts it is very clever. So there's this woman, and she's so how old are you? Okay. So in the course of the story, it's a graphic novel. Right. It's about $8. In the course of the story, you know it, she's having all these things happening, especially in the I see you got Bill dressed up already.
Don't be afraid.